The question of how often seniors should shower is one that often goes unasked, or when it is, receives a blanket, often inaccurate answer. In a society that often equates cleanliness with daily showers, it's easy to assume that the more frequent the bathing, the better. However, as we age, our bodies undergo significant changes that necessitate a re-evaluation of our hygiene routines. What was once a simple, straightforward daily ritual may now require a more nuanced and individualized approach. This comprehensive guide aims to dispel the myths surrounding showering frequency for seniors and provide a clear, evidence-based understanding of the factors that should influence your personal hygiene practices. We'll delve into the science behind aging skin, explore the role of personal hygiene needs, examine the potential risks of overshowering, and offer practical alternatives that can help you stay fresh and clean without compromising your health or comfort. By the end of this detailed exploration, you'll have the knowledge and tools to make informed decisions about your showering routine, ensuring that you're striking the right balance between cleanliness, skin health, and overall well-being. This isn't just about hygiene, it's about empowering you to take control of your health and embrace a more sustainable and personalized approach to self-care. Before we dive in, if you're enjoying this insightful content and finding it valuable, please take a moment to give us a thumbs up. And for more empowering information on senior health, wellness, and lifestyle, be sure to subscribe to our channel and hit the notification bell so you never miss an update. Your support helps us create more content that informs, inspires, and empowers you to live your best life. Now, let's get started. 1. Skin health changes with age, understanding the delicate balance. Imagine stepping out of a hot shower, toweling off, and immediately feeling a tightening sensation across your skin. Perhaps you notice flakiness on your arms or legs, or an uncomfortable itchiness that seems to intensify after bathing. This isn't just a random occurrence, it's a sign that your skin is changing with age, and your showering routine may no longer be serving its best interests. As we age, our skin undergoes a series of transformations that significantly impact its ability to retain moisture and maintain its protective barrier. The epidermis, the outermost layer of skin, becomes thinner, reducing its capacity to hold water. The sebaceous glands responsible for producing sebum, the skin's natural oil, become less active, leading to decreased oil production. These changes, combined with a decline in collagen and elastin, result in skin that is more prone to dryness, irritation, and damage. The impact of showering on aging skin is significant. Hot water and harsh soaps strip away the already limited natural oils, leaving the skin vulnerable to dryness, itching, and cracking. This is because the skin's natural moisture barrier, which is essential for protecting against environmental irritants and preventing water loss, is compromised by frequent washing. Many seniors find that after showering, they must immediately apply heavy lotions and creams to combat the uncomfortable dryness. However, even with diligent moisturizing, the skin may still feel rough, irritated, and more fragile than it used to be. The case of Susan. Take the example of Susan, a 72-year-old who cherished her morning showers. As the years passed, she noticed persistent red, itchy patches on her arms and legs. Despite using various moisturizers, her skin remained rough and irritated. It wasn't until she consulted her doctor that she realized her daily showers were exacerbating the problem. By reducing her showering frequency and switching to a gentle, fragrance-free cleanser, Susan was able to restore her skin's natural balance and find relief from her discomfort. Dermatologist recommendations. Dermatologists often recommend that seniors reduce their showering frequency and opt for milder, fragrance-free soaps that won't strip the skin of its natural oils. This is because the skin's ability to replenish these oils diminishes with age, making it more susceptible to dryness and irritation. The goal isn't to eliminate showers altogether, but to find the right balance that keeps you clean while protecting your skin's delicate ecosystem. By understanding the changes that occur in aging skin and adjusting your showering routine accordingly, you can maintain optimal hygiene without compromising your skin's health and comfort. 2. The role of personal hygiene needs beyond the daily shower mindset. For many seniors, the idea of showering every day is deeply ingrained, a habit passed down through generations. However, as we age, our bodies undergo changes that can significantly alter our personal hygiene needs. What was once a necessity may now be unnecessary or even detrimental to our health and well-being. As we age, our bodies tend to produce less sweat and oil, which means we may not accumulate dirt and bacteria as quickly as younger adults. This is due to a decrease in the activity of sweat glands and sebaceous glands, resulting in a reduction in both perspiration and sebum production. Therefore, the need for daily showers may not be as critical as it once was. The case of Jim. Consider Jim, a 75-year-old retired mechanic. In his younger years, he worked long, physically demanding shifts in a hot garage, requiring a shower immediately upon returning home. However, in retirement, his daily activities are much less strenuous. He spends most of his time indoors, taking leisurely walks around the neighborhood and reading in his favorite chair. He realized that even when he skipped a shower, he didn't feel greasy or smell bad. This realization prompted him to question the necessity of his daily showering routine. Factors to consider. Several factors can influence your personal hygiene needs, including activity level. If you lead an active lifestyle and engage in regular physical activity, you may need to shower more frequently. Climate. Hot and humid climates can increase sweating and the need for more frequent bathing. Medical conditions. Certain medical conditions, such as incontinence or skin infections, may necessitate more frequent showering. Personal preference. Ultimately, the decision of how often to shower is a personal one. It's essential to listen to your body and adjust your routine based on your individual needs and preferences. The importance of fresh clothing. Changing into fresh clothes regularly, especially undergarments and socks, plays a significant role in maintaining hygiene without requiring a full body wash daily. Clean clothing helps to absorb sweat and prevent the buildup of bacteria, contributing to overall freshness. The key is to challenge the notion that daily showers are an absolute necessity and to adopt a more individualized approach based on your body's specific needs and circumstances. Third, risks of overshowering, disrupting the body's natural balance. While cleanliness is undoubtedly important, overshowering can actually do more harm than good, especially for seniors. Excessive washing can disrupt the skin's natural balance, leaving it vulnerable to a range of problems and increasing the risk of infections. Stripping away natural oils. One of the primary risks of overshowering is the removal of the skin's natural protective oils. These oils play a crucial role in keeping the skin hydrated and acting as a barrier against bacteria, dirt, and other environmental irritants. When these oils are washed away too frequently, especially with hot water and harsh soaps, the skin is left exposed and more prone to dryness, itching, and cracking. Cracked skin and infections. Cracked skin is not only uncomfortable, but also creates tiny openings that allow bacteria to enter, increasing the risk of infections. This is particularly concerning for seniors with weakened immune systems, as infections can become more severe and difficult to treat. The case of Ellen. Ellen, a 78-year-old retired school principal, had always prided herself on maintaining impeccable hygiene, adhering to a strict daily shower routine. However, over time, she noticed that her skin felt constantly dry and irritated, regardless of how much lotion she applied. Eventually, small cracks developed on her feet, leading to a painful infection. Her doctor explained that excessive showering was washing away the natural oils her skin needed to stay protected. By reducing her showering frequency and switching to a gentler soap, Ellen experienced a dramatic improvement in her skin's condition. Aggravating skin conditions. Overshowering can also exacerbate existing skin conditions such as eczema and psoriasis, making symptoms worse and causing unnecessary discomfort. The frequent washing can further irritate the skin, leading to redness, peeling, and even painful rashes. Disrupting the skin's microbiome. The skin is home to a diverse community of beneficial bacteria that help protect us from harmful pathogens. Washing too often, especially with antibacterial soaps, can disrupt this delicate balance, making the body more susceptible to infections. Temperature sensitivity. Some seniors experience increased sensitivity to temperature changes due to compromised moisture retention, making hot showers feel harsh and cold air more irritating. It's crucial to recognize that more isn't always better when it comes to showering. If you're experiencing excessive dryness, itching, or irritation, it may be time to reevaluate your routine. The goal is to stay clean without harming your body's natural defenses. 4. The importance of cleaning key areas daily, a targeted approach to hygiene. Even if a full-body shower isn't necessary every day, maintaining hygiene is still crucial. Certain areas of the body, such as the face, underarms, and groin, are more prone to accumulating bacteria, sweat, and odors, making daily cleansing essential. Many seniors find that a quick wash in the sink or using a warm washcloth is sufficient to stay fresh without the risks of overshowering. Underarms. The underarms contain a high concentration of sweat glands. While overall sweat production decreases with age, the sweat that does accumulate can mix with bacteria, leading to noticeable body odor. Regularly washing the underarms with mild soap and warm water helps eliminate odor and keeps the skin healthy. Groin area. The groin area also requires special attention, as moisture buildup in this region can lead to irritation, fungal infections, and discomfort. A simple daily wipe with a gentle, non-irritating cleanser can prevent these issues. The case of Henry. Henry, an 80-year-old retired postman, had always taken daily showers. However, arthritis made it difficult for him to stand for long periods. He discovered that washing his underarms, face, and groin each morning kept him feeling just as fresh. His skin improved, and he no longer struggled with dryness. Face. The face benefits from daily cleansing to remove sweat, oil and environmental pollutants that can build up throughout the day, leading to irritation or clogged pores. A gentle face wash or rinsing with lukewarm water can help refresh the skin. Feet. Foot health is essential, especially for seniors with diabetes or circulation issues. Keeping the feet clean and dry helps prevent infections and maintain comfort. Cleansing wipes and no-rinse cleansers. For seniors with limited mobility, cleansing wipes, damp washcloths, or no-rinse cleansers offer a simple and effective way to maintain hygiene without needing a full shower. Targeted cleansing allows you to focus on the areas that need the most attention while protecting the rest of your skin from unnecessary dryness. 5. Medical conditions and mobility issues. Matter, adapting to individual needs. Medical conditions and mobility challenges significantly impact how often seniors can bathe. What was once a simple daily habit can become physically demanding, especially for those dealing with arthritis, balance issues, or chronic pain. Cognitive impairments can also make showering stressful. The key is finding a routine that maintains hygiene, safety, and comfort. Arthritis. Stepping into a tub or standing in the shower can be painful and exhausting for seniors with arthritis. While warmth may feel good initially, pain can lead to avoiding showers altogether. The case of Barbara. Barbara, a 77-year-old retired nurse, had always been meticulous about her hygiene. As her arthritis worsened, showering became overwhelming. She discovered that a shower chair and a handheld shower head allowed her to bathe more comfortably. Risk of falls. Slippery surfaces and limited mobility increase the risk of accidents in the bathroom. Seniors recovering from surgeries, using walkers or canes, or with balance issues may hesitate to shower frequently or require assistance. Sponge baths or assisted bathing can be safer options. Dementia. For seniors with dementia, showering can be anxiety-inducing. Memory loss can cause resistance due to confusion or discomfort. Caregivers should adjust schedules for comfort. Warm washcloths or shorter routines can maintain cleanliness without distress. Incontinence. Some seniors need more frequent bathing due to accidents. Hygiene is crucial, but minimizing the effects of washing is possible with gentle, fragrance-free cleansers and moisturizers. Every person's situation is unique. There's no universal rule for showering frequency. Adjust routines, use assistive tools, or seek help from caregivers. The most important thing is finding a balance between cleanliness and comfort. 6. Alternatives to daily showering, embracing gentle and effective cleansing methods. For many seniors, a full shower every day isn't necessary, but hygiene shouldn't be neglected. Many ways to stay fresh without showering every morning include dry skin, mobility challenges, or personal preference. Adjusting hygiene routines to include alternative cleansing methods helps feel refreshed without excessive showering. Sponge bath. Using a warm, damp washcloth with mild soap or cleansing solution helps remove sweat, dirt, and bacteria without stripping the skin's natural oils. This method is useful for seniors who have trouble standing or find traditional bathing uncomfortable. A quick wipe of key areas is effective. The case of Richard. Richard, an 81-year-old former carpenter, switched to sponge baths after hip surgery with full showers twice a week. He felt clean and comfortable without exhaustion or slipping. No-rinse cleansing products. Special body wipes and foam cleansers are designed for those who can't shower frequently. These products are gentle don't require water, and are convenient for maintaining hygiene between showers. Hospitals and senior care facilities use these products for effectiveness and ease of use. Moisturizing cleansers. Unlike harsh, drying soaps, moisturizing cleansers remove dirt while keeping skin hydrated. A mild, fragrance-free cleanser reduces irritation and keeps skin soft. Dry shampoo. For hair hygiene, dry shampoo keeps hair fresh without daily washing. Washing hair too often can lead to dryness and breakage, so dry shampoo or rinsing with water every few days maintains cleanliness while preserving natural moisture. The goal is to find a routine that works for you, whether it's full showers a few times a week, sponge baths in between, or mixed cleansing methods. Conclusion: embracing a personalized approach to senior hygiene. We've covered important points about how often seniors should shower. There's no single answer. The ideal routine depends on skin health, hygiene needs, medical conditions, and mobility. Showering every day might be best for some, while others prefer a few times a week with daily targeted cleansing. The key is that overshowering can do more harm than good, especially as we age. If you struggle with dry skin or irritation, rethink your routine. Simple changes like gentler soap, moisturizing cleanser, or sponge baths can make a big difference. Remember, hygiene isn't just about showering. Keeping clothes clean, washing hands, and caring for key areas like the face, underarms, and groin are important. We encourage you to share your thoughts and experiences. How often do you shower, and has your routine changed? Do you have tips that have helped you stay fresh? Leave a comment below. If you enjoyed this video and found it helpful, please like and subscribe. Your support helps us create more content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.